How do you read this fetal heart tracing that most people usually are afraid of? Basically, try to break it into pieces and then analyze it the best that you can. So this is the way I read. When you see they give you the strip, just step back and think about it. There's two portions of it. This is for the mother, and this for the baby. And these are the contraction of the mother. Okay. And these are the fetal heart tracing recorded. And there's numbers on top of it. And you can see there's fetal heart over here, 240, that's the maximum. Okay, the minimum is 30. So this is the range. Okay, and this is the range for the baby. The range for the baby. So initially, the way to read this is look at the contraction phase. I start from the bottom. And then you look at the contraction. They've given you magnitude of the contraction from 0, okay, here and then up to 100. So they've given you different measurements. This is the pressure in millimeter per mercury, and this is different Pascal. So different reading. It doesn't matter. You have to know what is normal. Okay, like normal EKG, look at the line, the two thick lines. There's a thick line here. There's another thick line, another thick line, another thick line. Between the thick lines, if you count, there's 1, 2, 3, 4, 5, 6. There's 6 small lines. From here to here is 1 minute. From here to here, 1 minute. So the distance between two thick line is just 1 minute, which is 60 seconds. That means the small lines are usually 10 seconds apart. So 10 seconds, 10 seconds, 10 seconds. So this is 1 minute, 2 minutes, 3, 4. When you count, usually they give you 10 minutes strip. So the whole thing, usually when they give you in exams, it will be a 10-minute strip. So this is the basics, okay? Now, you look at it, there's a normal contraction. You're supposed to have less than 5 contraction or 5 or less, okay? Contraction in 10 minutes. This is normal, okay? That's the normal of contraction. That means the peak, you should read 1 peak. There's only 2 peak within 10 minutes, so this is good. So you shouldn't see more than 5. If you see 1 here, another 1 here, if you see like 6 peaks within the a strip, that means that tell you that tachysystole, that means it's going too fast. It can cause contraction, and then that's abnormal contraction. So you have to let the OB and the attending know about what is going on, the doctor basically. And so this is normal. The other thing too is the distance, the contraction from here all the way coming here. It shouldn't be more than 90 seconds. And the distance between one contraction and the beginning of the another shouldn't be more than 2 minutes. So this doesn't show that this only have 2. So you can see at the end of this contraction, there's more than 2 minutes. Like you have 1, 2, 3, 4, 4.5 minutes before the next contraction comes. Tracing. So this is all you need to know for the mother. So the mother has 2 contractions within 10 minutes. And the magnitude are okay. And the contraction length, you can see, it starts from here to here, and it's less than 2 minutes. You see, it ends before 2 minutes. So these contractions are no longer than 90 seconds. Then you go to the baby. The baby, you're looking for the amplitude, the variability. If there's no variability, that means that the heart rate goes up and down. The maximum one, I think, this is 150, this is 180, this is 160. And this is 120, and this is 110. So this is normal, baby, 110 to 160. That's the heart rate of the baby. And that's all. You're looking for whether the contraction, then the second one, whether something happens. So this is the contraction going up like that. There's nothing happening to the baby. This is a little bit, but you don't see, you see variability. There's no deceleration. That means the heart rate doesn't drop more than it's within the baseline. That's the baseline. Okay. Then you go up a little bit. Going up is good. So it doesn't drip all the way down and come. So as the contraction start, I don't see any deceleration. I don't see anything. So this is a normal strip with a normal variability. And that's all. That's how you read it. Read the mommy contraction, see how many contractions are within the strip. That means looking for peak. There's 2 contractions within 10 minutes. That's good. You don't want to have more than 5. See the distance between one contraction, the end of it and the beginning of it should be at least 2 minutes. And then check the magnitude, then you're done. Okay. And you have to know that the distance between one thick line and the other is just 1 minute. And then you look at the baby heart rate and what happened to the baby when the mother contracts. So like here, when I draw a peak all the way here, there's no deepening. It looks normal. And that's all you need to know. Okay. So we're going to use it to answer a startup question as usual. So that's the easy way to remember EKG, fetal heart tracing. Okay. Remember, this is normal. Okay, normal and rate 110 to 160 is for the baby. So let's go. Now we have 4 clients. They are in labor. Which of the following need immediate priority action? Select all that apply. So you have 4 EKG strips of fetal contraction and monitoring. Which patient do you think need immediate action? So we've seen the number 1 already. This is the same thing I gave. So this is the normal. There's a variability. The peaks, there's 2 contraction. That is good. There's no deceleration. So this patient doesn't need anything basically. So I don't need to see this first. Then number 2, what do we have here? You do the same thing. Look at the mother contraction. There's what? 3 contractions. It's less than 5. So that's good. On the mother side, the distance between the end of one contraction and the another is good. It's like 2 minutes. Perfect. One to another is 2 minutes. And the length of this is almost like 90. So that's good. Then you look at the peak. What is happening to the peak? When you go up like that, what happened? At the beginning of contraction, everything looked fine. But when you get to the peak, what happened? Then the baby starts to go down. So this is the problem we have. So as they go down, at the peak, you have the heart rate of the baby start dipping down. This is the late deceleration. So this is late. It doesn't happen at the beginning, so it happens at late deceleration. So I need to do something about this. You know what late deceleration is? It's placenta insufficiency. So either you have to do some maneuver, turn the mommy on the left side, give them some oxygen and improve blood flow. But this patient needs to be seen. It's late deceleration. Then number 3, what do we have? The same thing, 1, 2, 3 contraction, that's good. The distance from here to here is also good. It's more than 2 minutes. From here to here is not greater than 90 seconds. And then at the baby, at the beginning of contraction, you start the baby heart start going down. And at the peak, the baby has dipped down. Is the baseline. This is the maximum, and it has dropped down right at the peak. You can see right at the peak. This is called, and it begins to decrease right from the beginning. And this is the early deceleration. So early deceleration is head compression. It's also not good. We got to do something about it. Okay. The baby head is being compressed. We don't like that. But it's good. It's better than that. But at least we have to do something about it. It's not that the worst of it. Of all, mostly some people will say early deceleration is okay, We don't need anything, but just know that they're called, you're having head compression of the baby. So there's no actual emergency. This is more emergent than that. Then number 4, what do we have? So it's the same thing. This is the mother, okay? And this is the baby. So at the peak of the contraction, look at it. When the mommy strikes, there's 3 peaks. So that means less than 5, that's good. This distance is almost the same as that. So that's fine. At the beginning of the contraction, the baby heart rate rather went up. At the peak of the mother, it also went up. And they all came down. The same thing. We all went up and came down. So the baby heart rate is mirroring the contraction of the mother. This is acceleration, okay? So it's accelerating, going together with the mother. So this is okay. There's nothing you can do. So it's good. So you don't need to do anything about this one. The same thing. This is 3 peaks. That's 3 contraction within 10 minutes. And as the contraction start, nothing happened to the baby. It's in the baseline. And then before the beginning of the contraction of the another one, it just went really all the way down. It doesn't correspond really well. It's like in the middle, not late, not early, and sometimes in the middle. The same thing happened here. Contraction has completely finished. It has finished before the baby heart rate comes down. This is what we call variable deceleration. And that is not good. It's called compression. So this is called compression, basically. And then you have to see these patients. So variable deceleration, the deceleration that doesn't correspond with the contraction. It can be before, during, and after. And that is the key. So we see this patient, we see this patient. We may have to, head compression, like I said, it's not that bad, but we may have to do something about this one. So those are the 3 you need to see. Of course, you have to know your chop. Okay, I know everybody knows about it. So that's variable deceleration is due to cord compression. Early deceleration is due to head compression. And then acceleration is okay. And late deceleration is placenta insufficiency. And you have to know how to manage each of them. And so that is the way to do this. Straightforward, very important. I mean, I know when you see it, you get scared, but just know, especially with the next generation cases, this is a typical one they can put in there for you to analyze everything, to make a treatment, have multiple drop-offs, and do a lot of SATA, select all that apply. It may be multiple SATAs in that, because I can ask you so many questions on this tracing. What do you do next? How do you intervene? What do you expect? So that's why I'm training you here. So I hope this is helping. And then before we finish, I just want to show you, these are all the tracing. I try to put them together and make it easy so that you can see them. You can see how you have one slide with all of them. So this is the mother contraction. There's 3 contractions, okay? 3 contractions, this is good, less than 5. So, but just by looking at this, I'm good. And this is almost more than 2 minutes. Then the first one, you look, as the contraction begin, what happened to this? They begin to rise, then come down at the end of the contraction. As the contraction begin, it rise. So this is acceleration. This one, so this is A. This one, you start from here, as the contraction begin, right as the contraction begin, the baby comes down. And then this, the peak of the contraction, mirror image that of the deceleration. And this is the early deceleration. And you follow each peak. And we saw this, you can see at the peak of this contraction, there's nothing. But when everything's finished before the baby decelerates. So this is the variable deceleration. And this one, at the peak of contraction, you see, that's when the baby heart rate starts to come down and then level up. You do the same thing here. At the peak, you come down. So this is the late deceleration. And the top one, you see, it looked like sinus, multiple contraction, sinusoidal shape. The fetal heart rate look like sinusoidal, like that. Okay, unlike this wavy variability, this one there's no variability. It's like sinusoidal. This is dangerous. Okay, when you see this, when they give you this, you spell like that: sino, NU, sinusoidal waveform. When you see this, this is severe anemia, fetal anemia. And this may be RH isomerization. Maybe the mommy will have, say, there's some RH positive and negative interacting. So you show that the baby has severe anemia. That is dangerous. So this is another bad fetal heart tracing. All of these bad ones are level 3. Okay, they're category 3. I don't want to bore you too much about them. Usually they don't ask you to list whether, but category 3 ones are those with the late recurrent, okay, recurrent late deceleration, and recurrent variable deceleration and sinusoidal. Those are the 3 ones, level 3. You have to worry about it. Okay, so this is the end of it. Select all that apply can be given to you in different forms, different flavors. I just took EKG fetal heart tracing and make a question out of it to try to get you guys thinking. And I hope this content is making you more confident, and that may help you pass your exams. Okay, take care of yourself and have a great day, and keep charging as always. All the best of luck.